Hello everyone. I would like to share a little information about the COVID-19 virus, which is popularly known as the coronavirus, and it has been declared by the WHO as the pandemic and epidemic communicable disease. Let's focus on the Indian trends about this virus. So before going into the actual information about the Indian traits of this virus, I would like to deny completely the statement because I have been looking at this statement saying that it's because of the Indian culture, Indian traditions, and the Indian behaviors and the habits. The virus is not spreading as much as seen in the China and the European countries. But it is completely a false statement, and it is nowhere related to the Indian behaviors. And to be honest, we have to accept that Indian cultural is different, but Indian human behavior is completely uncivilized and a stupid behavior. To understand my statements, first you need to look at the statistics given by the Health Ministry and the welfare associations of the government, central government of India. Until today, it is like March 20 and 9 a.m. It has been given reports like it has screened 14 lakh and 31,734 cases so far, and all these were screened at the airports, those who were traveling, internationals and the domestic to abroad. And apart from that, they have been screened 171 cases in the Indian subcontinent. So of which it's around like 14 lakh 32,000 for example. So yes, so of which this huge number, only 163 cases have been confirmed with the viral presence in their blood streams. But the fact is, the 163 cases are not scattered all over the India in a equal distribution. We can see only the major proportions of the cases in the Maharashtra, Delhi, Kerala and Karnataka. If you look at the patterns of these states which do business or which have some connections with the worldwide, easily you can observe here, like Maharashtra, it's in the highest number with 44 confirmed cases, whereas the Delhi it's 16 and Karnataka it's 19 and Kerala it is been like 26. So if you notice, if you observe this out, these are all the cases out of 163 confirmed Indian viral. So only the popular cities and the popular states which have a regular international connections and regular international trades and some missionary works which we can see in some Kerala states. So in these states, people move in and around of the India frequently. So this is the major factor why the viral count is more in these particular states. So here there is nowhere involvement of the Indian culture or the Indian traditions or the Indian behaviors, because I give a simple example. This, especially the coronavirus virus, is spreads with the droplet infections, and in India we have a habit of spitting everywhere on the roads, and people think like the roads and the city and the whatever the landscapes in and around India are owned by themselves. They simply spit. They have a habit of gutka and they have a habit of pan. And even in my experiences, I have seen most of the Indian educated people spits on the road as like they feel like it is a sink for them or like a washrooms for them. And the people who gave the statements like it is because of the Indian behavior not to give shake hands. In fact, that is not directly related to the contact. It is majorly distributed by the droplet infections. So the people don't have any basic knowledge of the viral transmissions or the particularly about the coronaviral pathogens. People can easily spit out the words how they spit the sputum from their mouths. So it's nowhere related to the Indian traditions. It's purely a pandemic disease. So first they need to understand what is pandemic. It is the pandemic we give the term usually the pandemic when a disease crosses across the continents and which it distributes throughout the globe, and so far it has been distributed to 159 countries, and people don't have any idea about these situations. They think only about the China, and they always think that is a China virus. And you should not blame any country in the name of why in this health crisis situations, because China is nowhere directly involved in propagating these viral transmissions from animals to the humans. It may be some of the indirect causative factors, but the viral is not new thing. It is a new variant in the corona family. This new variant has emerged only because of its adaptability. Since 10 years or 12 years, it has been surviving in different forms of animals, different kinds of animal respiratory tracts, and it is being modifying itself into a new variant of corona family. So people, those who don't have the actual knowledge of this scientific evidences or the medical evidences available directly, they can easily blame a country, and they can easily praise a country in the name of culture or the behaviors. And one more thing, another viral messages or the statements going on, in this Sunday there is going to be a curfew from morning to night. It's okay, forbidding and lockdown, it's very essential because it's purely a airborne disease. So here there is nothing to do with the Modi, or there is nothing to do with any political parties. These are the guidelines passed by the WHO, not even by the Indian Indian Health Welfare Associations. Lockdown is done in major developed countries like the European, even US. They have locked down themselves prior to this Indian situation. You need to understand here, people should encourage the lockdown, but they should not take it as a political agenda. There is nothing involvement of the Modi and his government. He is only in the position to pass those guidelines as an administrator, as an head of the administrating body.